Okie dokie. All right, so welcome back. We are going to start with in the matters of before going back to the work session part of our agenda.
Great. Let me pull up my thing. Sorry, I'm not looking at you. My other screen's to my right here. So, all right. So this is under agenda item 4, and we're starting with 4B. So case number 2022-5032. Everybody got me? The proposal is to issue a notice of proposed discipline and final order with that includes $1,000 per month fine for every month of practice, which was a total of $12,000. The expectation that the licensee will pay $1,200 of that fine and the remainder to be stayed due to his retirement status.
So moved.
That was Karen?
Yeah.
Okay. Need a second?
Second.
That's Scott.
Scott seconds.
Yep.
We have a motion and a second. Any further discussion? Okay, Seth,
Aye.
Karen,
Aye.
Scott,
Aye.
Corey,
Aye.
Lori,
I am so sorry.
and I for myself, motion carries.
I thought we were gonna start diving pretty soon.
All right, so for case number 2023-5001, the proposal is to issue a notice of proposed discipline for unlicensed practice with a fine of $5,000 for each violation, which totals $15,000 to be paid within 90 days.
So moved.
Lori?
Second.
Karen?
Karen seconds. We have a motion and a second. Any further discussion? Seth, did we lose you?
No, it wouldn't let me turn my mic on. Stupid.
Yeah.
Yeah, aye. Yeah, it would.
Karen,
It's a conspiracy.
Aye.
Scott,
Aye.
Corey,
Aye.
Lori,
Aye.
I for myself, motion carries.
I asked
All right.
for the previous case, did we notate how quickly that payment had to be made, the fine?
Oh, for
No, we
50,
did
32.
not. For 5032.
Yeah.
60 days.
Okay, within 60 days then. All right. Next up, we did this one. Case number 2022-5002. You guys follow me? Okay. The proposal is for insufficient evidence.
So moved.
Second.
Lori seconds. We have a motion and a second. Any further discussion? All right, Seth,
Aye.
Karen,
Aye.
Scott,
Aye.
Corey,
Aye.
Lori,
Aye.
and I for myself, motion carries.
Great. For case number 2022-1000, the proposal is to issue a contingent case closed with 2 hours of continuing education in vitals to be taken within 30 days. And those 2 hours are in addition to the 20 hours required for renewal. And also a requirement to send copy of their newsletters to OBCE for the next year.
So moved.
Second.
We have a motion and a second. Any further discussion? All right, Seth,
Aye.
Karen,
Aye.
Scott,
Aye.
Corey,
Aye.
Lori,
Aye.
Aye for myself, motion carries.
Great. For case number 2023-5013, the proposal is for a no statutory violation.
So moved. Second.
We have a motion and a second. Any further discussion? All right. Seth,
Aye.
Karen,
Aye.
Scott,
Aye.
Corey,
Aye.
Lori.
Aye.
Aye for myself, motion carries.
Great. For case number 2023-5028, it's insufficient evidence.
So moved.
Karen,
I'll
Yeah.
second.
Michelle, all right.
We have a motion and a second. Any further discussion? All right, Seth,
Aye.
Karen,
Aye.
Scott,
Aye.
Corey,
Aye.
Lori.
Aye.
Aye for myself, motion carries.
Great. Now we're down to case number 2023-5015, and that proposal is to ratify the final order.
So moved.
Second.
Seth seconds. We have a motion and a second. Any further discussion? Seth,
Aye.
Karen,
Aye.
Scott,
Aye.
Corey,
Aye.
Lori.
Aye.
Aye for myself, motion carries.
Great. Case number 2022-1015. The proposal is to issue a contingent case closed with 2 hours of continuing education on vitals and 2 hours of continuing education on stroke screening, all to be completed within 60 days and in addition to the 20 hours required for annual renewal.
So moved.
Second.
Lori seconds. We have a motion and a second. Any further discussion? All right, Seth,
Aye.
Karen,
Aye.
Scott,
Aye.
Corey,
Aye.
Lori.
Aye.
Aye for myself, motion carries.
Great. For case number 2023-5021, it's the calls for insufficient evidence and a dismissal of the interim consent order.
So moved.
That was Karen.
Second.
Who got it?
Ooh,
The other person.
is that Corey?
I second, yeah.
Corey, got it.
We have a motion and a second. Any further discussion? All right, Seth,
Aye.
Karen,
Aye.
Scott,
Aye.
Corey,
Aye.
Lori.
Aye.
Aye for myself, motion carries.
Great. For case number 2022-3021, the proposal is to issue a notice of proposed discipline with a fine of $1,000 to be paid within 3 months.
So moved.
Second.
Lori seconds. We have a motion and a second. Any further discussion? Seth,
Aye.
Karen,
Aye.
Scott,
Aye.
Corey,
Aye.
Lori.
Aye.
Aye for myself, motion carries.
All right. For case number 2023-5022, it's insufficient evidence.
So moved.
Second.
Scott seconds. Motion and a second. Any further discussion? Seth,
Aye.
Karen,
Aye.
Scott,
Aye.
Corey,
Aye.
Lori,
Aye.
and aye for myself, motion carries.
All right. For case number 2023-1005, proposal is to issue a notice of proposed discipline with successful completion of all parts of EBAS and Pro B to be completed within 90 days. In addition to that, it would be a fine of $20,000 to be paid within 90 days. We also, this notice will also include 2 hours of continuing education in documentation, 2 hours of continuing education in vitals, 2 hours of continuing education in clinical justification, all to be completed within 60 days, and 3 file reviews of 3 MVA records within a year.
So moved.
Second.
I'm sorry, who is the mover?
Scott moved, Seth second.
Thanks.
We have a motion and a second. Any further discussion? Seth,
Aye.
Karen,
Aye.
Scott?
Aye.
Corey,
Aye.
Lori?
Aye.
I for myself, motion carries.
Great. For case number 2021-3020, the proposal is to issue a notice of proposed discipline that includes a $5,000 fine to be paid within 30 days and for the licensee to not reapply as a licensee, or the applicant, I should say.
So moved.
Seth?
Second.
Second by Karen. We have a motion and a second. Any further discussion? All right, Seth,
Aye.
Karen,
Aye.
Scott,
Aye.
Corey,
Aye.
Lori?
Aye.
I for myself, motion carries.
Thank you. Case number 2022-5010. Proposal is to issue a notice of oh, I'm sorry. We will not move forward on that case. Jumping. For case number 2023-1008, it would be for no statutory violation.
So moved.
Second. We have a motion and a second. Any further discussion? Seth,
Aye.
Karen,
Aye.
Scott,
Aye.
Corey,
Aye.
Lori?
Aye.
I for myself, motion carries.
All right. Now for case number 2021-3005, proposal is to issue a notice of proposed discipline with a $10,000 fine to be paid within 90 days.
So moved.
Second.
Seth seconds. We have a motion and a second. Any further discussion? Seth,
Aye.
Karen,
Aye.
Scott?
Aye.
Corey,
Aye.
Lori?
Aye.
And I for myself, motion carries.
And that's all you're in the matters of.
Good job. All right, it's our favorite part. CA study guide.
All right, Mackenzie.
I took a big deep breath, kind of regulate myself. Okay. I'm gonna share my screen. I think I found where we left off, so that's at least nice. You guys don't have to view all the scrolling.
Yeah, there should be a comment that said literally left off here or something that Heather put.
Oh, okay. Well, that would make more sense.
There you go. Start here.
Yeah. Cool. So let me delete that because I don't want to forget. Okay. All right. So we are in the application of, oh my goodness. LVG, it seems like.
Okay.
Yeah. And you guys had removed quite a bit and are trying to just simplify. Yeah. So looks like just a simplification of what was already there. Seems like you guys might have gotten all the way through application and then we're moving back to the high voltage stuff, but I'm not 100% sure.
I think that's what, I do think that's what we did.
Yeah,
Okay.
we got kind of through most of it and then we worked our way back up for some reason. But I think, yeah, I think it's,
Okay. And I think high voltage, the number's gonna have to change, so let me just scroll up here, so it'll be 17. Unless you want it to be a part of LVG, but, or that chapter above.
I think it's this new chapter, but I don't know.
Yeah.
And the numbers are screwy, so.
I think Heather did a really good job trying to track, because we started changing a bunch of things and we were smushing things together, so I'll go with this and then we'll double check before we publish.
Well, because 16 is electrotherapy, which this would fall under.
Yeah, so it may
So-
be a sub of 16.
Okay, so 16.8.
Yeah.
Okay.
Okay.
So like the others, do we need all this history?
Delete.
Delete the first paragraph, I'd say, at least.
What did we leave for low volt? You can't remember.
Pretty limited. So this is what this one says. Here, I can change it so you guys can just see what's left. Oh my goodness, hold on. Close your eyes. Scroll back up. There we go. Okay, here's what's left.
Okay.
Seems like we would want to delete this figure 13 part. Oh, it says add picture. Never mind.
Okay, so
Oh, man.
I do think you could probably get rid of that first paragraph. Because the second one seems to be more in line with what we wrote for low volt.
You talking about keep this one?
Or, well,
Or
I mean, edit it,
reword it a
but-
little, yeah.
yeah. The first sentence and the last one's a little redundant.
Do you want to
Yeah, I'd
remove
say
it?
delete one of those. Either the first or the last.
I'd say the last, but that's just me. Has more words.
Cass, I'm gonna get out of this because you guys have been working on this anyway without me. So if you have any questions, you can try and text, email me. I'm around.
Awesome. Thanks, Lori.
Okay.
Thank you,
Have a good weekend,
Lori.
everybody. Bye-bye.
Bye.
Nobody else get any ideas? Mackenzie, she's like, damn.
I was already going this direction.
Okay.
Even that third sentence, build strength and promote wound healing. Couldn't we somehow put that into the first sentence?
Do we need it at all?
No.
Not necessarily.
I would just delete.
Reduce pain, muscle spasm. So,
I would just delete that last sentence too.
yeah. Uh, it is, I think the second one, you could probably make it less wordy.
It is often used in treating both acute and chronic injuries.
Yep.
Beautiful.
Boom.
Mm-hmm.
Okay, so
So again, are we just going to take out the table and just have the indications list?
yeah,
I
that's
think
what
that's
I
what we
was
were talking about before.
yeah.
Is there anything we want to grab from the table before I delete it?
Well, it will be the list, so the condition that's there, so the things that are listed under condition are actually the indications. So all that text would be the indications, and that's it.
So just in a list like 1 through 9.
Yeah,
Okay. Hold on.
And yeah, and take out all the effects.
yeah,
Ugh.
You can do it later. It's okay.
yeah. Because you just make a note to delete the table and just leave the conditions or the whatever. How they
Okay.
call it, the indication.
Real quick, what is chiropractic joint dysfunction compared to just joint dysfunction?
Don't ask questions.
I
Just go with it.
it's probably left over from differentiating between like chiropractic subluxation versus a medical subluxation, you know?
I mean, these
That's-
are
Okay.
That's my
I'll go with
theory.
that.
these are artifacts from back in the day, so we have no idea. I mean, this is so so we should probably just delete chiropractic and just have joint dysfunction.
Yeah, I mean, that would make more sense, I think. Instead of physical therapy, joint dysfunction.
You never know. Alrighty. So on this one, we put on the other one, see general contraindications, because we had consolidated the whole list. Okay, guys, who does this?
Not it.
Nose goes.
I don't use this in my office. I'll be
Yeah,
honest.
me
like,
either.
it's kind of old school.
Yeah, I think I did it in school, but that was a long time ago.
But you look so young.
Okay, so can we get rid of number 1?
I would think so. And I would also get rid of as instructed in the introduction in number 2.
Yeah. Position to the patient, inspect the area and remove metal. Set all controls to 0.
Is that-
I'm
It's not the
I
metal
think-
that we're talking about, right? We're talking about
No,
a toll.
Okay.
all metals.
Mhm.
I'm like, they didn't come in first place. I'm not sure.
They could have just come from the track or something. I mean,
They could've.
you know, Just wear their medal.
All controls.
Can you just say set the, at number 5, set the pulse rate as directed? And delete
Yeah.
by your doctor.
Can we get rid of the rest of it too?
Yes, you can.
Wouldn't number 6 be directed as well?
Yeah.
The CA is not going to
Yeah.
choose which one they do. So you could say set the pulse rate and the mode or something.
Yeah. There we go.
There you go.
Now, the pads in water, isn't that just ancient?
Yes.
Do you want the whole thing or
Place conductive gel on the pads. Would that make more sense?
Sure.
Prepare pads.
Well, on the one for low volt, we put soak pads thoroughly or place gel on them.
Oh, really? Okay.
Let's do
Mhm.
that.
Do we have a figure 15? I think that's a
No.
no. Okay.
Can you just say like secure pads to the treatment area instead of
Yeah.
putting weights and rocks and packs and straps on them?
And double weights.
Yeah.
And rocks.
Yep. Tent stake. Yeah, you could just, yeah,
so you just want to delete this? Is that what I'm hearing?
yeah. And then,
Wait.
and then what did you say, Scott? What was the, not the apply, but secure?
Secure or something to that effect.
Yeah.
Hold on, we just got rid of that sometimes they use a small pad with a handle called a probe. Do we want that in there? I don't know how this works.
I don't know either. And we've had cases with regard to this.
Well, shouldn't the substitute with the probe thing be maybe in number 6? Or are you gonna?
Yeah, I think that's right, Scott. I think you can bring, Mackenzie, you can delete the second sentence and the third sentence in number 7. And then delete the sometimes instead of using electric pads. The substituting a very small pad on a handle, that probe language could come up into 6, Scott? Or maybe make it a 7 and then have the new 8 say apply and secure the pads? I don't know.
This picture that I found, it like looks like a watering can or something.
Could you say something like you can substitute a small pad on a handle? I don't know if we need to call it a probe, that operates like flat pads and allows you to treat small areas like trigger points or such as.
Yeah.
Say that one more time.
Say a small pad with a handle can be substituted and will operate like flat pads and is useful for small areas. And then you can take out the trigger points, acupuncture, and small muscles, because those are all small areas.
There
You
you
don't
go.
need to repeat it.
Perfect.
There you go. Good job, Scott.
Mm-hmm. And wouldn't it be turn the timer to the directed time of treatment?
And get rid of the 15 to 20 minutes.
Yeah.
So on low volt, we put turn the intensity dial up slowly to patient tolerance.
Can probably be the same, right?
Yeah.
Can you read that again?
Turn the intensity dial up slowly to patient tolerance. Can we get rid of the rest of that?
I'd say so.
Anybody?
Yeah, delete the rest.
Yeah, that's exactly. Okay.
I'd
Okay.
say once treatment ends or once treatment is over, turn all controls to 0.
Looks good.
Want over or completed?
What?
Said you want over or completed?
Oh, we said over on the last one too.
Over under, I like.
Over under.
Do we want low voltage to be part of the chapter as well?
I think so.
Yeah. Yeah.
No.
cut. So I'd probably cut the first sentence. And
Couldn't we just-
then, go ahead.
I was gonna say, couldn't we just copy and paste from above? Wasn't the last section, the first sentence, the exact same?
Except for the exercising muscles part.
Yeah,
But yeah, we could just add it. Reduce pain. Relax muscles. Decrease swelling. Okay. Just double checking. And then so relax muscles, comma, decrease swelling, comma, and exercise muscles.
is
Can you
that
actually
just
change
strength?
that? Can you just say that LVAC is used to reduce pain, relax or exercise muscles and decrease swelling?
I wouldn't lump them
No? Okay.
only because one is, you know, yeah, they're kind of opposites.
Well, if you
Well,
threw an
then-
or. Go ahead.
Well, I don't know if this is what Scott was gonna say, but instead of exercise muscles, what if we said strengthen muscles?
There you go.
Yeah,
Okay.
So can we lose that second paragraph then?
Yep.
Do we want to add the actual, I mean, I know it says it in the title, but technically when you have an acronym, you're supposed to like spell it out.
Yeah, I would.
Okay.
I would, the opposite way, Mackenzie, spell it first and then acronym, yeah.
I don't know that this one's used for acute injuries.
Yeah, I don't think.
why don't you just
Although-
delete it?
Yeah. Yeah, just delete that whole line. I mean, you might use it in re-education, like post knee surgery, but I don't know how often we do that in Cairo.
Delete,
Yeah.
put the last sentence of the supervising doctor.
Yep.
Or sorry, keep that last sentence
That's
and
the
just
other way around. That's the only one to
delete
keep.
the rest of yeah, delete the rest of the paragraph.
And make that part of the first one.
Yeah. I think so.
So we deleted all the
Oh.
terms on up above. Should we just delete these?
Well, I'm wondering if we should just keep those bottom 3 bullet points. So that they at least know what the doctor's talking about if, you know, they're
Mhm,
actually
okay.
doing it. I don't know.
Instead of terms, then should we call it settings?
We can do that.
And this, Mackenzie, this would be the same thing with the table and the list of indications. So is it chiropractic subluxations?
Or just make it joint dysfunction so it looks like the other one.
Yeah.
Oh, this does say acute soft tissue injuries.
Do you need the example of strain and ligament sprain in there or no?
No.
And can it just be muscle and nerve pain instead of muscles? Number 9.
Muscles.
All
Did
right.
we want to add that sentence back that we deleted that included acute and chronic? Since it's here.
Nah.
No.
It's there.
Can you consolidate 3 and 4 into muscle spasm or weakness, or are they they're two different things, aren't they?
Yeah.
Okay.
All right. So we can say see general contraindications again.
I love the through the eyes contraindication.
Very horror movie.
All right. Yep. Okay.
I got the right middle this time.
You can keep scrolling, please, Mackenzie.
So what was it? Soak the pads thoroughly.
Oh, yes.
What was the top? Soak pads thoroughly, yeah.
Do we leave the rest of that?
Do you want a figure? Do you guys want to put an image in here or no?
No. I say no. Anyone can speak up and tell me that they disagree. So
No. Do we want, for consistency, it says once treatment is over, do we want the same verbiage for number 8 here? Or is it close enough?
Yeah, so I looked at the low volt one again and it mirrors more of this one. It doesn't say when the treatment is over. I misspoke. Or it just says turn the intensity dial to 0 before removing pads. That's what low volt says.
Do we want to go back up and change that in the previous one so it matches? This one says once treatment. So just say after treatment here. Be consistent.
Sure.
I saw a nod, I'm doing it.
Okay. Look good? All right, we're moving on to 10s.
Oh, that's fantastic.
This is going faster.
That's a good thing, right?
Yes.
We're not just to the delete phase.
Just delete the whole document. Okay. What are we doing, people?
Can you just say TENS is a small portable electrical stimulator that can be
Yes.
carried, but get rid of all the rest?
Mm-hmm.
I have like a fanny pack in mind.
How
So you
about
could-
move electrically, electrotherapy that stimulates nerves by sending an electric current across the skin?
Yeah, but that's not. I don't think that's specific enough to TENS.
Do we need that first sentence?
Are they tested on it?
Will they? Do we want them tested on it? That's the question. Like, I don't really care that they know that those other types of electrical therapies could be considered TENS because it sends a current all across the skin. I want them to know that the TENS unit that I'm sending home with my patient is such and such, you know?
Perfect.
I think it's better to keep it simple because I mean they're not applying these as far as I know. This is more just like didactic general information.
Well, but
I
they
mean,
may
do
be
you have a
instructed.
CA put a yeah? Are you guys using CAs to put TENS units on people and explain it?
I don't.
A lot of doctors add TENS to their initial training list, though.
Yeah. I mean, as a CA, I was actually trained to instruct patients how to use it, but I don't because I'm a control freak about that. But I still don't think we need the first sentence, personally.
Yeah, I mean, you can leave that, the written out and the acronym and just bring in that second sentence to it. And like TENS is the small portable electrical stimulator. I mean, a small. A small electrical stimulator.
Used to relieve acute and chronic pain.
Yep, there you go.
delete
Second paragraph.
at least the
Don't get rid of
second.
don't get rid of the third one yet. Please.
Do we, at any point, I want to see if we, if it's listed elsewhere other than that next paragraph that says it can be worn for hours at a time. Do we think that's important that they know?
Yeah, I do.
Yeah.
Can we wrap it into that third sentence somehow? Or, I mean, this, yeah, I'm pointing, you can't see. The many types of tens. I don't know, some of this might actually be helpful, and if we could like put that in here somewhere.
Is it, would you say worn?
Or used.
Used 4 hours. Say it again, someone.
This
For
is
several hours at a time.
I think it's nice to have it right before the supervising DC part because it really
Yeah.
clarifies that they still
Can
have
you
to
make
go
that-
back.
Can you make that may rather than many?
Yes.
And then also that second sentence in this paragraph, there are many different types of mens. Each may vary. It's ITS, not it is.
Wait, say what? I'm sorry.
It's
Each
supposed to be
may vary.
ITS. It's wave form rather than ITS.
Oh.
Rather
So
than it is.
We took out a lot of the wave terminology in the earlier electrotherapy. Should we just take this out too?
Yeah, totally. It's not necessary.
Yeah.
And even the control switch one, we don't need any of that either. I don't think.
Well, that might actually
You
be
want it?
helpful, especially
Okay.
because if they're instructed on how to change that on a TENS unit to send it home with a patient.
Got it. Yeah.
That looks good to me.
On that last sentence, you want to put treatment settings and time? The
Well, I mean,
supervisor said-
time is a setting.
Oh, is it? Okay, I don't use it.
We get to go down? Go down
Mhm.
here? Okay.
All right. Do we need these?
I think it's an odd paragraph.
The first one?
Yeah.
Yeah. Can we get rid of it?
Yes.
That last sentence seems like a good test question.
So random. So would the CA be instructing them or would the DC be instructing them?
Depends on the office.
Yeah, I mean, a CA can.
Okay.
Can we maybe take out the verbally repeat and reenact the instructions?
Yep.
Do we need to have that in there?
No.
it is best to instruct them. There we go.
There
Thanks,
we go.
Mackenzie. Are we leaving the battery part in, guys?
What about AAA batteries?
I've only seen
No.
9 volts.
Rechargeable.
You start putting them all on there. Could be.
And I would say sending them with patients, not sending them to the patients. You can delete the there. Yeah.
What do you need to replace or change them? Can't you just do one or the other? Or just make sure that they work?
Yeah, I mean, that's a really good, and Scott, the fact that you have little kids at home, that's hysterical. So it's like replace or change the kids or replace or change the batteries. Okay.
Can we maybe put if needed on replacing the batteries at the end of the sentence?
Do we even have to say it?
I don't know.
What about just check the batteries?
I mean, I would probably just delete that sentence, because how do you check the battery life? Unless, I guess you might have a fancy battery tester, right?
Well, if it's a 9 volt, you lick it.
God, are you telling me you have a trickle
Sorry.
charger in your office? Come on.
I'm coming from an EMT background where we were responsible for checking the batteries on everything on the ambulance before every tour.
That's why I like you so much. You're a fellow EMT.
Right on.
Do one see one teach, man. You got to train all day long.
Are we good with these review sentences? Do we want to move this sentence back up with the other two? Or I'm sorry, this paragraph?
Yeah, above the figure.
Yeah.
Yeah,
Okay, 1 second.
I think that's a good idea.
It's just kind of floating down there by itself.
Good job.
Don't want anyone to miss it and think we're trying to trick them.
We laugh, but
Uh-huh.
okay. Okay, hold on. Sorry, I gotta renumber.
So this is page of what? I can't see. Or should I not?
40 of 64.
Oh boy.
There's a lot of pictures at the end, guys.
Yeah.
So many.
Okay, so you've left the note for the table. Contraindications, we can just say see general again, right?
Mm-hmm.
Application.
Won't the control and the pad attachment or placement be determined by the chiropractor? Or is the CA going to decide where they go?
I almost feel like we don't need this section. I don't know.
Good with not having it.
Do you see what's right below it? It's a whole chapter on electrode pad placement.
Oh, Lord.
What?
So just
No.
wanted you to know.
Well, if that's the case, then we definitely don't need this application section.
And yeah. I'm fine getting rid of it. Anybody else?
Delete it.
What? This is electrode pad placement for tens.
So I'm thinking we don't need it, but
I don't really think so either.
This could be the new application section. Just, you know.
that's true. But see, it's saying over painful areas, over acupuncture points. But that's a completely different modality than what is within scope of chiropractic. So why would we want to, I don't know.
Unless it's a wellness clinic.
Yeah. I would say delete, but I'm a delete-aholic at this point.
What do y'all
So
think?
are we gonna have any kind of application?
My thought
As
was,
instructed.
yeah, my thought
Or as
was,
directed.
like just saying something about making sure that the pads stick and the leads are plugged in, because I don't know. Do very many people use these like actually in their office? I feel like it's mostly for home use.
Yeah, I mean, it is for home use. But, I mean, don't they need to know how to instruct the patient, right?
But is the doctor going to do that part?
Well, the CA can.
All right, fine.
Do you want to
Well-
rename this section application? Oh, go ahead, Karen.
Well, I was just gonna see, can we cut and paste any of those lines from earlier? Just the generals, you know? Just to make sure that the leads are plugged in.
Is there a part of this section that you guys want to grab and pull down or keep?
I think she was talking about from a previous electrical therapy
Mhm.
type.
Okay. Let's go up. So yeah, we have like this kind of instruction. We could mirror that and just specify. Is that what you're talking about, Karen?
Yeah, I'm just wondering if any of that we can take.
Did you bring enough for everybody, Michelle?
Yep, here you go. My current obsession.
You're like about the movie and you hear somebody crinkling and you're like, hell's got that popcorn.
Okay. So we can get rid of number 1.
Now, I don't know of anybody that uses a TENS or that sends out a TENS unit that is not a sticky pad.
Yeah.
I agree. Oh, hold on though. On number 1, should we say like something about make sure that it's dry?
Yeah.
Does metal matter in the treatment area for TENS? So we could say instruct patient to remove all metal or something like that.
Oh, yeah. And make sure the treatment area is dry.
It sounds like dry the metal. Help someone. Instruct patient to remove all metal and dry.
How about just remove all metal from treatment area and ensure treat area is dry?
Okay. Just there's a lot of treatments in one sentence, so I was trying to.
Horses, 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 horses.
Okay, so on 3, do you want to just get rid of that, Karen? What do you want to do with that?
Yeah, I would. Let's see, can we say, make sure pads and leads are plugged in?
Securely?
Yeah.
Just for
Yeah.
consistency, is it okay if we, instead of saying instruct the patient, because that would be what all of this is, can we just say like ensure the removal of all metal or ensure all metal is removed?
Yeah. Okay, so then if we had a new number 4, if it's place pads around or on the painful area.
Do we need to put it in there at all that there could be 2 or 4 pads? I saw it was in there at one point, but I think that is helpful because we have some with both.
Can you construct a sentence that I'll add?
Oh yeah, let me get on that real quick.
Put you on the spot, sorry.
No, it's fine.
Well,
Either
okay,
2 or 4 pads can be used. I mean, it's something very
Yeah.
simple.
maybe used.
Or just take out either, just 2 or 4 pads may be used.
Now, I mean, from this point on, in general, they just, at least the machines that we use, they just have to turn the intensity up,
Yeah,
right? So,
get rid of 5 and 6.
yeah.
But what if you have one of those units that has like monophasic, biphasic, and modulated?
But you should have set that theoretically, right? So you're just telling the patient, like, now you're going to turn the intensity up.
Okay, that makes sense to me, as long as it's somewhere like, don't touch these. No.
Oh, right. Oh,
Wait, Michelle, are you relying on common sense for these people again?
Ouch.
well, that's what I tell them. I set the thing, I close the door and I say, don't touch this. Just turn these knobs.
I guess if you left it out, it wouldn't motivate someone to tinker with it because they wouldn't even have it in their thought process of like, oh, maybe I should change the setting. Just say, put the pads on, turn it up till it feels like it's right, and don't mess with it.
No touchy.
That's a different section of this instruction booklet.
Okay. Well, okay. Increase intensity. I think you could just cut that to increase the intensity gradually. Or, you know, I don't know. I feel like I'm going back and forth between these are instructions to the CA and these are instructions to the patient. Like,
but I feel like you got to leave something, or they'll just turn it up until, I don't know, till their
Okay.
AM goes to 11.
You write it.
I thought it was good the way it was written. I was like, I mean, that's what
All
I tell
right,
my
put it back.
too.
Well,
Like, turn it up until you hit your threshold.
undo, Mackenzie.
I don't know. This is a shorter sentence, Seth, and it captures what you wanted.
That's fine.
There you go. To patient comfort. Okay, there you go.
Okay, and after we got through all that, you'll remember that
I'm
there was a whole section.
executive, but I'm a Q-tip in public.
No comment. Okay, so if you remember it, this was a whole another chapter down below here, and we put application back. So do we want anything from this section to be included up in what we just were working on?
I don't.
Nope.
And do we want to insert another image?
No. Can we get rid of length of treatment? We already said something about it being able to be worn for a long time. Boom.
Out of here.
All right. Mackenzie, the one that you just edited, you can get rid of because I think it's the way it's scanned in because 25 is the same thing.
I went to unmute myself, but I was already muted. Okay, so actually I'm gonna leave it, but it's my note where I left off for my editing because below this is where the formatting gets awful. And so I'm gonna leave it for my own benefit, but
hey.
Yeah. So just heads
so
up
you can,
if it looks weird.
So you can be like, I didn't touch this part. Don't blame me.
See, I even
pretty much. This is uncharted territory now from this point forward.
Woo!
It's fair warning. So we'll make all edits to this, but I'll just end up retyping it because it's all in the wrong format. So
okay.
So if we make it shorter, you're helping me out.
Wild frontier.
Yeah. Okay, here we go.
Okay.
What do we just say? MES. I mean, microcurrents is is used for treatment of sports injuries. I mean, is that necessary even like, is this used in practice?
I know a couple people, I think it's microcurrent.
Okay.
It's popular for facelifts, non-surgical.
This is the
My
one
turn.
with the glove, right?
Keep that comment. I'll keep my response PG here. Yes, it involves a glove. Two sometimes.
I'm gonna scroll up and see like how we phrased the previous one because I felt like we were really like concise. Is a small portable unit to relieve acute and chronic pain. So that's what we said. I just so everyone knows. So that said,
But I've never seen a portable microcurrent device. Does anybody else?
I
I
think
don't
she's
know.
just trying to help us be concise.
yes, I don't know if
Okay.
it's portable. I have absolutely no idea.
I was gonna say I've never seen a portable microcurrent device. It's usually part of like the larger format for what your
Here, I'll
whatever
just remove that word. It's not helpful.
electrotherapy unit is.
You're behind the times, Seth. Catch up.
Have you ever seen a portable MES?
No, I'm kidding.
I was gonna say if they make them, that's fantastic. You want to need that energy device thing.
Oh man.
Okay.
I use unicorns.
Can you just
What'd
say
you say?
something? After MES, it says an electrical. Yeah. No. Where am I? You confuse me. Is it MES is an electrical stimulation commonly used in sports injuries or something to that effect?
There you go. Craig for the win. Help us get back on track.
Or used to treat sports injuries.
Is it small though? Uses a small current.
Oh, I have no idea. I usually see them at big, like Seth said. Usually they're bigger, aren't they?
That's what I thought.
They have them, guys. Google, they have them. They're like $100. They look like a tens machine, but it all sounds like a tens machine to me. But they call them MESs. I don't know. You can't really see it when I do that. That was my input.
Thank you. All right. Can we, do we need to add anything else? Can we get rid of the second paragraph? Cut.
Well, hold on. Should we say somewhere that it's a microcurrent and is sometimes not felt by the patient, something like that? Like why it's called microcurrent?
Makes sense to me.
Yeah, that makes sense. That makes it different than tens. There we go.
Could you just say it uses a very small micro amperage current, which may not be felt immediately by the patient or something like that?
Not
Is that what you're
commonly
trying to
felt
get
by the
at?
patient during treatment.
Yeah.
It's totally placebo effect device.
Beautiful. All right. Same thing on contraindications.
They even have a portable device that has 4 type of simulators: TENS, microcurrent, EMS, and IF. $80, guys. $80.
Wow.
Mhm.
Very good. All right, what are we gonna do about application here?
I think it looks pretty good. I mean, it repeats the part of it they shouldn't feel electricity, so. But it does indicate that they should be made aware of it.
Well, the other one is like numbered out, all the other applications. Do this, then do this.
Well, why don't we just cut and paste from the TENS, because it's basically the same thing.
Are you gonna be okay with that though? Because the language won't match until we change it.
But it should match. I mean, it's the same application.
I don't know. Just teasing.
It's just
I have
you
no
don't
idea.
indicate, that it's not going to have an intensity level. So I think it would be just turn it up to whatever the prescribed setting is.
Okay,
But
so
it should be
here's
stated by the physician.
the copy and paste. So what we're seeing right now.
How about on number 5, increase the intensity gradually to prescribed setting or prescribed level, prescribed voltage.
Let's go setting.
Michelle, who was that professor we had that would throw out like 5 or 6 different synonyms for the same thing? Tall, thin guy. He taught spinal anatomy.
Jim?
Carollo?
Carollo, that's it. Thank you. I feel like this hole, this portal, this aperture, this lumen, are we a friend? Okay.
Gosh.
He was like a thesaurus with legs. But only for medical terminology.
Are we
That's
happy
another
with
word for
these?
cup.
Are we happy with these application instructions?
Do we need to put something in there about the gloves though?
Yeah, it says something about it down here. It's pretty specific.
Yeah. What about in the part where we say, like the number 4, the place the pads are on the painful area? Can we put the gloves in there somewhere and get rid of all the other stuff? I need help.
Hmm. How about if we did it specifically for like 16.24 is electropad or electrode application? And then
What?
16.25, it's glove. Because it references gloves down lower.
I know, but it doesn't like really say anything.
No. Hmm.
If we're applying pads or maybe something like alternatively, gloves may be used to administer the treatment or something to that effect. Karen, where are you?
I'm seeing a footnote here.
I have no idea if that's right. I'm just trying to shorten it.
You know, the UWS one doesn't say anything about gloves. It says probes.
Oh, Lord.
Everyone in their probes.
What if it was just 2 pads, comma 4 pads, comma, or gloves may be used to transmit the current?
There you go. See? There we go. Can we get rid of all that now?
Yeah.
And that. Do we
Can we
want
get a
that
different
picture?
glove? Yeah, can we get a different picture? That's
Wow, wow, wow.
Yes, please.
Well, in that picture, Mackenzie goes with figure 20, like it's labeled underneath that.
Yeah.
Mhm.
Do we need it?
No. I mean, that looks like that body contouring application more than anything else.
Mm. All right, IFC.
Is this a new chapter or the same chapter?
It's still under electrotherapy.
Can we put like in parentheses IFC after that? Just a lot easier, or for clarification, or is that?
Yeah, that's good.
Is it inferential current therapy? Is that the full name?
Interferential current.
Interferential current.
Okay.
should we
So why
just
don't
take
we-
out the therapy?
Yeah, we could
Yeah.
just put current rather than therapy at the title. Or we may not even need all this intro in anyway.
It's quite the explanation.
There we go. Go, Mackenzie, go.
I'm on a roll. You guys just
Mhm.
tell me if I need to back up. I missed something. This seems kind of more application related. What do you guys think?
What's the photo look like? I mean, it looks like it just,
It's an awful, I mean, you can't really see it. I know it's zoomed in, but it looks really bad. And
pixelated.
yeah.
It's nice though. I mean, the content's nice. But it looks crummy, so you want to delete it? Just let it go.
We could try to find another one.
I think it'd be helpful.
Kelly concerned with any kind of copyright infringement with these?
Mackenzie's working her magic. It's fine, Seth.
I mean, we did get their permission, so I don't know is the answer to that question, but we did ask them for it, so. I would say at this point we've rewritten most of this document though, so.
I actually kind of like this paragraph. What does everybody else think?
Yeah, I think out of all of them, it makes the most sense to include.
It's like the crux of the name of. We don't need that.
How about the image? This one.
I don't really know that we need it either. That all looks the same.
And you notice it's never a female practitioner and a male patient. It's always the reverse. It drives me a little insane.
Okay, so this is where we're at. We just deleted
Okay.
that stuff in between.
Everyone okay with that? Nobody's objecting, so
Yeah.
I'm just gonna keep moving. I feel like a bull in a china cabinet right now. Like, just keep going. Okay, do we want these on there?
No.
Well, yeah, I was gonna say, aren't they gonna be directed as to which frequency to use? So I don't think
Yeah.
it much matters.
Bye-bye.
Bye-bye.
Okay. C, general contraindications. There is no apply on this one.
All right. Ultraviolet. New chapter, same chapter. What do we want to do?
That's different.
What did you say?
That's different. That's not,
Okay.
right? That's not electrical therapy.
You guys, you just did electrical therapy chapter. It's done. Okay, let me change these numbers and we can look at it.
Only one more sand dune over there.
27. Would we be okay with a 5-minute break?
Yes. Yep.
Okay.
Let's come back at 3.